Have you ever wondered what your doctor truly thinks when you walk into their office? It's not a thought most people want to entertain, but the reality is, behind those polite smiles and professional tones, some doctors may hold unspoken beliefs about older patients that influence the care they provide. These beliefs aren't often discussed openly, and they aren't always flattering. Yet, they can directly impact how your symptoms are understood, how your treatment plan is developed, and even which options are offered to you. In this video, we're going to uncover 5 revealing truths about what many doctors really think about older adults. Understanding these truths is the first step toward ensuring you receive the respect and care you deserve in every medical setting. Stick with me until the end, because the final truth might change the way you approach your next appointment. Let's dive in. Number 1. They often assume most symptoms are just a part of aging. One of the most frustrating things many older adults experience is that some doctors quickly dismiss their symptoms as simply being part of getting older. You might go in complaining of joint pain, fatigue, or memory issues, and instead of investigating further, the response might be something like, "Well, that's just what happens as you age." While aging can bring certain changes, this assumption can lead to misdiagnosis and delayed treatment for conditions that are real and treatable. The problem is that once a symptom is attributed to aging, the urgency to look deeper often fades away. For example, that shortness of breath might be written off as part of slowing down when it could actually be a sign of heart disease, or that occasional forgetfulness might be brushed off as a harmless senior moment when it could be linked to medication side effects or a thyroid issue, both of which can be. By assuming the symptom is just due to aging, opportunities for proper diagnosis, prevention, and recovery are missed. This mindset doesn't always stem from malice. Many doctors are under pressure to see a high number of patients in a short amount of time, and when they hear familiar complaints from older patients, it can be tempting to default to the simplest explanation. The problem is, simple isn't always accurate. Treatable conditions like depression, vitamin deficiencies, or early-stage cancers have been overlooked this way, leaving patients to suffer longer than necessary. I once knew an 82-year-old man named Robert who began experiencing extreme fatigue and occasional dizziness. His doctor initially dismissed it as just slowing down with age and told him to rest more. It wasn't until months later, when Robert insisted on further tests, that they discovered he had a heart valve issue that could be corrected. Once treated, his energy returned, and he often said he wished someone had taken his initial complaints more seriously. It's important for seniors to remember that aging isn't a one-size-fits-all explanation for every ache, pain, or change in health. Yes, the body changes over time, but those changes should be carefully examined, not brushed off. A persistent cough, unexplained weight loss, or sudden changes in mobility deserve a thorough evaluation, no matter your age. When doctors look beyond age-related assumptions, they can identify issues that, if addressed, can improve both quality of life and longevity. As a patient, it's crucial to speak up, ask questions, and make it clear that you want answers, not just reassurance that it's normal for your age. You deserve the same level of attention and care as someone decades younger, because your health is just as valuable at 80 as it was at 40. Number 2, they may believe older patients are less likely to follow treatment plans. Another unspoken truth is that some doctors believe older patients are less likely to follow medical instructions as carefully as younger ones. This perception can stem from stereotypes, past experiences, or even unconscious bias. If a doctor assumes you won't follow a treatment plan, they might simplify it in ways that aren't in your best interest or avoid offering more complex options altogether. While the intention might be to make things easier, it can result in you receiving less thorough care than you deserve. This belief often arises from concerns about memory, hearing, or the ability to manage multiple medications. A doctor might think, if I give too many details, they'll forget, or if I prescribe this, it'll be too complicated for them. While it's true that some older adults face challenges with managing medications, following complex instructions, or remembering details, it's a mistake to assume this applies to everyone. Many people in their 70s and 80s are fully capable of following detailed instructions, keeping track of their medication schedules, and even researching their own health conditions to make informed decisions. When a doctor holds back on explaining all available options, it can prevent you from making choices that could significantly improve your health. For example, a specialist might skip discussing cutting-edge therapies for arthritis because they assume you wouldn't want to deal with the extra steps, despite you being perfectly willing and able to try. Or they might not fully explain how certain lifestyle changes could complement your medication to better control your blood pressure. In both cases, you're left with an incomplete picture and miss out on the opportunity to make the best decision for yourself. I once spoke with a woman named Carol who was 79 when she was diagnosed with a heart condition. Her first cardiologist gave her a very basic treatment plan, assuming she wouldn't want anything too demanding. However, Carol wanted to take an active role in her health. When she changed doctors, her new physician took the time to explain all available options, from medication combinations to diet changes and exercise routines. With this more detailed approach, she was able to manage her condition much better. This is why it's so important to show your doctor that you're engaged and ready to take an active role in your care. Bring a notebook to appointments, ask for written instructions, and don't hesitate to ask questions if something is unclear. By demonstrating that you can and will follow through, you help challenge the assumption that older patients cannot handle complex care plans. Ultimately, following treatment isn't about age, it's about willingness, support, and clear communication. When doctors see that you're committed, they're more likely to share every available option, giving you the chance to choose the path that offers the best chance for health and quality of life. If you're still watching and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you do so and turn on the bell so you don't miss any videos. Your support helps us continue creating valuable content to inform and inspire you. Now let's move on. Number 3, they may prioritize younger patients in certain situations. It's an uncomfortable truth, but in some cases, doctors may unconsciously give more attention or priority to younger patients, especially when time and resources are limited. This bias doesn't necessarily come from a place of disregard, but can stem from the belief that younger patients have more years ahead of them, and therefore more to gain from aggressive treatments. For older adults, this can mean receiving less urgency, fewer follow-ups, or being overlooked for procedures that could still offer significant benefits. In busy hospitals or clinics, when a physician is juggling multiple patients, they might instinctively devote more time to someone who is 20 or 30 years younger, thinking their intervention will have a greater long-term impact. The problem with this reasoning is that it overlooks the immense value of improving quality of life at any age. A person who is 75 deserves the same opportunity to feel strong, capable, and pain-free as someone who is 40. Prioritizing by age alone fails to consider how much well-timed treatment can improve an older patient's independence, dignity, and daily joy. Sometimes this bias can affect which diagnostic tests are ordered. An older patient might be told that a test isn't necessary because their symptoms are assumed to be a normal part of aging, while a younger patient with the same symptoms might be tested immediately. Similarly, when it comes to surgery, a physician may avoid suggesting a procedure, assuming recovery will be harder for an older patient, without even asking if the patient is willing to take on that challenge. I remember speaking with an 82-year-old man named Richard, who started experiencing severe knee pain. His first doctor dismissed the idea of knee replacement surgery, saying it was too much for his age. But Richard was active, healthy, and eager to stay that way. When he sought a second opinion, the new surgeon evaluated him based on his overall health, not just his age. Richard had the surgery, recovered well, and returned to daily walks that he had missed for years. The key takeaway here is that age should be only one factor in medical decisions, not the deciding factor. Your overall health, mindset, and personal goals matter just as much. That's why it's essential to communicate openly with your doctor about what you want out of your care. If you feel sidelined or that your needs are being placed behind those of younger patients, it's okay to speak up or even seek a second opinion. By reminding doctors that you value your time, comfort, and future, you help shift the conversation from how long will they live to how well can they live. This shift can make all the difference in the care you receive. Number 4, they may see your life goals as less important. Another hidden truth is that some doctors, often without realizing it, make assumptions about what matters to older patients. They may believe that by the time you reach your 70s or 80s, your priorities are limited to comfort and basic health maintenance rather than pursuing personal goals, hobbies, or new experiences. This mindset can quietly influence the kind of advice and treatment they offer. If they think your only aim is to get by, they might overlook opportunities that could help you stay active, travel, or enjoy the activities you love most. For example, if you mention knee pain, a doctor might focus only on managing the discomfort with medication instead of discussing surgical or physical therapy options that could help you return to hiking, biking, or other activities you enjoy, dancing, gardening, or traveling. Sometimes doctors may recommend the easiest, quickest treatment, assuming you aren't interested in putting in the extra effort for a bigger payoff in the long run. This mindset can be limiting, especially if you have clear, vibrant goals for your future. I once knew a woman named Ellen who was 81 and dreamed of visiting her granddaughter overseas. She had a chronic lung condition, and her doctor initially suggested she focus on staying comfortable at home. But Ellen wanted more than just comfort. She wanted to feel well enough to make the trip. When she explained this to a different physician, he worked with her on a targeted exercise plan, updated her medications, and helped her prepare for the physical demands of travel. 6 months later, Ellen was able to make the journey, and she said it was one of the happiest moments of her life. The lesson here is that your goals matter, no matter your age. Whether you want to keep gardening, join a community group, or take a special trip, your medical care should support those ambitions. If your doctor doesn't ask about your life beyond basic health, make sure you bring it up yourself. Share what you hope to achieve, and ask how your care can be shaped to help you get there. When doctors see you as a whole person with dreams and plans, not just as a patient to keep stable, they can tailor their recommendations in ways that make a real difference. And that can mean living not just longer, but better. If you're still watching and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you do so and turn on the bell so you don't miss any videos. Your support helps us continue creating content to inform and inspire you. Now, let's move on. Number 5, they may underestimate the emotional impact of aging on health. While many doctors focus heavily on physical symptoms, some overlook how much emotional well-being affects a patient's overall health, especially for older adults. Aging isn't just about joints, blood pressure, and lab results. It's also about adapting to loss, changes in identity, and sometimes living with reduced independence. When the emotional side of health is ignored, treatment plans can feel incomplete, leaving important needs unmet. Too often, doctors might attribute sadness, anxiety, or withdrawal to just aging, rather than seeing it as something that can and should be addressed. They may not ask about loneliness, grief, or fears about the future because it's not part of the standard checklist. But these emotional factors can directly impact physical health, affecting sleep patterns, appetite, immune response, and even how well the body recovers from illness. I remember speaking with a man named Leonard who had lost his wife of 54 years. His health began to decline rapidly afterward, but every doctor visit focused on adjusting his medications. No one asked how he was coping or whether he had support at home. It wasn't until a neighbor suggested counseling that Leonard began to feel like himself again. His physical health improved too, not because his prescriptions changed, but because someone helped him address the emotional weight he was carrying. The challenge is that emotional struggles in older adults can be harder to spot, especially if you don't speak up. A doctor might think you're fine because you answer, "I'm okay," when they ask how you're doing. That's why it's important to share what's really going on, even if it feels unrelated to your medical condition. Telling your doctor you're feeling down, stressed, or lonely is not complaining. It's giving them the full picture they need to help you. When the emotional side of aging is ignored, patients can feel unseen and unsupported, which can quietly undermine physical recovery. But when it's acknowledged and addressed, it can lead to better health outcomes, more energy, and a stronger sense of purpose. A good doctor will understand that treating you as a whole person means caring for both your and sometimes a single conversation about how you're feeling can be as important as any prescription. Hearing these truths can stir up a lot of emotions. Some of you may be nodding in agreement because you've experienced them firsthand, while others might feel frustrated or even hurt. But the goal of sharing this isn't to criticize all doctors or to make you lose trust in them. It's to remind you that your health and dignity deserve to be fully recognized, respected, and cared for at every stage of life. Understanding these realities can help you approach your appointments with more confidence, ask the right questions, and make sure your voice is heard. Aging doesn't make you less important. In fact, the experiences, wisdom, and resilience you carry are things no lab test can measure, yet they are vital to who you are. You have the right to expect medical care that treats you as a whole person, not just a list of symptoms or a birth date on a chart. If you ever feel overlooked or dismissed, it's not a sign to give up. It's a signal to speak up, seek a second opinion, or find a healthcare provider who values you for the unique individual you are. Over the years, I've learned that the best outcomes in medicine happen when patients and doctors work as a team. That means being honest about your concerns, asking for explanations when something is unclear, and remembering that you're an active participant in your care, not a passive recipient. When you approach your health with this mindset, you're much more likely to receive the attention, respect, and thorough care you deserve. So as you move forward, carry this knowledge with you. Let it guide you to stronger, more respectful relationships with those who care for your health. And never forget, your life, your story, and your well-being matter just as much now as they did decades ago. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.